Welcome to the American Academy of Grief Counseling's videogram on seasonal affective disorder, also known as SAD. So seasonal affective disorder is more than just the winter blues, but is an actual depression that is triggered due to the change of seasons themselves. 20%, according to stats, suffer from the winter blues, while 5% actually suffer from SAD. Now, SAD carries all of the symptoms of depression. The difference, though, is that it coincides with the change of the seasons, and it doesn't always have to be winter. There could be cases or instances when it also occurs during summer. So with the more common during the winter, due to the change of season, the body chemistry and the brain chemistry changes. So there's less activity, less daylight, colder temperatures, and hence due to the change of the clocks, different sleeping patterns as well. So due to this, there's going to be less serotonin, which equates to an imbalance and a possible depression. Serotonin becomes imbalanced because there is less vitamin D, and we receive most of our vitamin D through the sun. So lack of D negatively affects serotonin levels, which in fact affects depression in itself. Now, again, not everyone has these extreme negative effects. As I said, 20% for the winter blues, 5% for SAD itself. However, to be diagnosed, it has to involve at least a diagnosis of depression, but for SAD in particular, a depression that is manifested for 2 straight seasons in itself. So how do we counter this? Most time, SAD, just like any type of depression, requires a type of medication, something that rebalances neurotransmitters such as serotonin. But there are also other ways that can be tried to counter its effects. Due to the vitamin D deficiency within itself, one should consider supplementing, taking more D3 during the winter months itself. Also, with counseling, CBT, cognitive behavioral therapy, and reframing of the winter season, trying to think of the good things of winter and not just having a negative feeling about the cold and the dark itself, but to try to find some good things to actually be excited about. Remaining social. Again, that's one of the things that happens as the season changes. It's not as warm, you're not outside as much. So remaining social, going to the patio, exercising, walking outside, these things become limited. But if you can keep them up during the winter and go to the gym and just be able to do something maybe once a week that is social, that can really lift your spirits to some extent. Now, for those with more severe cases of SAD, there's also light therapy. It's a special type of bulb that is prescribed, and individuals will sit under it during certain times of the day to absorb some of the light that they need. Now, there are some side effects sometimes for those who utilize it. Migraines is one of them. So it's something that needs to be used properly and sparingly in its use itself. So we are the American Academy of Grief Counseling. This was just a short video on SAD, some of its symptoms and how to counter it. If you feel that you experience any of these, be sure to visit your healthcare provider or your mental health care provider. Our link below for purposes of becoming a certified member in grief counseling is below. Our email is info@aihcp.org, and our phone number is 330-652-7776. I'd like to thank you for listening and have a good day.